Joining me to talk more on this via Skype is Dr. Afoke Isiave, public health specialist. Good morning. Thank you for joining us on TVC Breakfast. Let's begin with this insulin tea, which NAFDAC has raised the alarm about, saying is in circulation. And I wonder how much of a concern this is for you.
Good morning. Thank you for having me on the news program today. From time to time, we get fake products in the market. It's a big concern because there is no evidence for what this tea claims to be doing. Today in medicine, we talk about evidence-based medicine. So for any medication, product or supplement that is brought to the market, it must have gone through the process to verify it's safe for human consumption, and then also to verify what it ascertains to be doing. So this tea has not passed any of those processes. It's just an anecdotal report.
Well, before now, NAFDAC again had raised the alarm concerning fake vaccines, so many fake, would I say, medical staples, if I may use the word, circulating in Nigeria. And the question on the lips of a lot of Nigerians is, why is Nigeria seemingly a viable market for products like this?
The truth of the matter is, when there are a lot of needs that have not been met, then anything will stand in the gap. So the health sector in Nigeria needs attention. If we don't have enough local production of medications or whatever, people are sick and people need solution to their problems. So they will go for whatever is available.
All right. What are these gaps that you see the government not bridging, or what is it that is not being done enough with regards to the health sector? Some would say that perhaps we need to begin to look at subsidizing for when it comes to issues bordering on health, because a lot of persons are not finding it pocket friendly when they have to take care of their health needs.
I think the first thing for us is to begin to produce locally and manufacture locally. If we're able to do that, then we'll solve most of our problems. As long as we continue to import and depend on foreign exchange, basic medications will continue to be out of the reach of Nigerians, because the costs will be dependent on the cost of dollar or whatever currency is used to import the product. My appeal to the policymakers is to make the environment friendly for local manufacturing and local production to take place.
Now let's look at diabetes itself, managing diabetes, which even WHO has said has been on a steady rise in recent years. I wonder what really the core is for this steady rise that we are seeing in recent times. Does it have to do with perhaps our lifestyle? What really is at the core of this steady rise?
Well, it's a combination of many factors. First of all, people are living older, getting older. Life expectancy is increasing. And then people have access to a lot of calories, carbohydrates, and people are not exercising. So it's a combination of increasing life expectancy and then poor diets and lifestyle habits.
One would say that perhaps increasing life expectancy is supposed to be a good thing, isn't it?
It is, but we need to put the basics in place. For instance, you're getting older, you cannot exercise in your environment because there's no work path for you to do that, or you're scared of falling into the wrong hands. So you're getting older, yes, but you need to go to the gym or exercise. You don't want to go to the gym. You can't afford to go to the gym, and then you can't exercise on the road. So a lot of factors are coming to play. So we need to actually go back to the drawing board, plan for aging, plan to have conducive environments that will encourage healthy lifestyles. I remember when I was growing up as a child, I would walk to school and walk back from school. But today it's not the case. People are concerned about security and all whatnot. So while increasing life expectancy is a blessing, we need to make sure our environment encourages us to maintain our healthy lifestyle.
All right. Now, another issue stemming out of the rising cases of diabetes is the diabetic amputation, which a lot of health experts are concerned about. Let's begin by understanding if, in the first place, it is preventable.
Diabetes-related lower limb amputation is preventable. Over 95% of amputations are preceded by ulcers, foot ulcers, and these foot ulcers are preventable. Preventable by adopting simple, basic foot care, daily techniques, making sure you have the right shoes on, not walking around without your shoes, and then making sure your blood sugar is well controlled. It's sadly preventable, but we still see a lot of amputations, preventable amputations.
When we are talking about lifestyle change, what are we looking at here?
Lifestyle change in terms of preventing diabetes or managing diabetes.
Prevent both.
Everybody needs to have a healthy lifestyle. We start off with what we are eating. What are we eating? Are we getting enough vegetables in our diet? What are we drinking? Are we drinking water, or are we drinking unnecessary energy drinks or calories? What about exercise? How active are we? Do you sit down, your day-to-day job, do you sit down for long intervals? If you find yourself doing this, you need to get up and move around, go to the car park, or just make sure you're active. The other is weight management. If you're too big for your height, you need to do something about that. And Lagos is a very, very stressful environment. We also need to manage our stress. So when you talk about good lifestyle modification management, we're talking about diet, exercise, weight management, stress management. They all come together to prevent non-communicable diseases like diabetes.
Now, perhaps you might want to be specific in terms of maybe options of food that persons can begin to adopt for this change in lifestyle. When we look at, a lot of people find perhaps rice as a staple and easily affordable. What more can persons adopt as options in that regard?
Okay, in terms of your diet, whatever you like eating, be it rice, be it amala, be it starch, whatever your staple is from your part of the country, nobody is saying you shouldn't eat it. Just watch the quantity and add vegetables. So if you are a rice person, you can add eforiro to your plate. Half of your plate vegetables. Is it eforiro? Do you like carrots, green beans, whatever vegetable you like? Just make sure you are incorporating vegetables to what you're eating and not just only carbohydrates.
Now, for the leg ulcers, one more thing I want us to quickly go back there. What are the warning signs for such that persons can take note of so they can quickly address it before the situation gets worse?
Warning signs for diabetes or amputation?
You mentioned leg ulcers.
Okay.
That leads to amputation. What are the warning signs?
Okay, they come in from what you feel to what you see. So what you feel, if your feet feel numb, or you have burning sensation in your feet, or you can't even, when you are stepping on the floor, you do not know if you're stepping on the floor, you feel like you're stepping on sand, or you feel as if ants are crawling on your feet, or you feel as if needles are pricking your feet. Those are symptoms of what we call peripheral neuropathy, nerve involvement. And then if we go further, if you notice any change in color of your foot, that's a red flag. If you see a wound on your foot, don't start doing home treatment. Just go to your doctor, let your doctor know you're living with diabetes and you have a foot ulcer. And then foot care, your nails, don't use sharp things on your nails. Don't use anything that can injure you on your nails. If you have to go and pray without your shoes, like some of the white garment churches and all that, make sure you put on your shoes to a safe place before you take it off. And if you're taking off your shoes, make sure the environment is safe. So basically, the warning signs are abnormal sensation on the feet and discoloration of the feet.
Now, some experts are saying that the rise in this amputation, it's a reflection of the state of our healthcare system. I wonder if that is what you see as well.
The truth of the matter is, for you to prevent amputations, you need healthcare workers that know what to look out for, right? There is a missing group in the system. They call the podiatrists, and they've been trained to look after the feet of people, not just people living with diabetes, but any foot-related problem. In developed countries where things are in order, these people join the team in the big hospitals in looking after persons with living with diabetes. But in the absence of podiatrists, then the healthcare workers have to know what to do. The doctors, the nurses have to know what to do. And there are a lot of programs going on empowering our community health extension workers, nurses, doctors, on how to examine the foot of persons living with diabetes and to identify the high-risk foot. Because once you are able to identify the high-risk foot, then you do all what you need to do to prevent it from developing a foot ulcer, remembering that over 80% of amputations are preceded by a foot ulcer.
All right, we have to leave the conversation here now, and we must say thank you, Dr. Afoke Isiave, public health specialist, for your time on the program. Thank you so much.
Thank you. Thank you for having me.
All right.